Chapter 8, Community Pharmacy Practice. We have the objectives in the beginning of the chapter. Tells you what you will be learning in this chapter. Then we have our terms and definitions, which we will cover in the chapter, but one fun thing that you can do is you can also click on these and it'll take you to where it is in the chapter. It's a little fun. A community pharmacy is also known as a retail or ambulatory care pharmacy. It is a vital component of our healthcare delivery system. There are many types of community pharmacies, including independent, franchise, and chain pharmacies. The independent pharmacy originally was known as the corner drugstore in a community. Often these pharmacies were classified as a sole proprietorship. Sole proprietor is someone who owns an unincorporated business by him or herself, according to the Internal Revenue Service. A franchise is an authorization granted to a person or group of people that allows them to operate under a franchisor's well-established trade name, and usually under the franchisor's guidance. A franchise company is a business organization in which a pharmacy with a successful product or service enters into a continuing contractual relationship with other pharmacies in exchange for a fee. Examples of franchise pharmacies include Medicine Shop, Good Neighbor Pharmacy, and Care Pharmacy. A chain pharmacy is a corporate-owned group of pharmacies that share a brand name and central management and usually have standardized business methods and practices. A chain must have at least two locations and have a central headquarters that is overseen by a board of directors. CVS and Walgreens are the two largest pharmacy chains in the United States. The pharmacy technician plays an instrumental role in our prescription processing system. Pharmacy technicians assist licensed pharmacists prepare prescription medications, provide customer service, and perform administrative duties in a community pharmacy. They are generally responsible for receiving prescription requests, inputting prescriptions, counting tablets, labeling bottles, maintaining patient profiles, preparing insurance claims, and preparing and performing administrative functions such as answering phones, stocking shelves, and operating cash registers. The primary role of the pharmacy technician in a community pharmacy is the same that is in an institutional pharmacy or any other pharmacy setting, to assist the pharmacist. That is our number one role, our number one goal. We are there for the pharmacist. If it wasn't for the pharmacist, we would not be there. A community pharmacy technician may be assigned a specific duty or many different responsibilities in the pharmacy. So some of the more common duties, provide customer service, take the information needed to fill a prescription from customer health professionals, answer the phone, obtain refill information, and then also input various types of data into a pharmacy information system. So examples of that would be adding a prescriber to the database, adding a patient to the database, adding insurance plans to the database, adding drugs to the database, processing a new prescription for prior drug approval. Compound prescriptions, perform necessary calculations before compounding a prescription. Package and label prescriptions, count the prescribed quantity of the medication, select the appropriate container, apply both the prescription and the auxiliary labels. Price medications, organize inventory and alert pharmacists to any shortages of medications or supplies. Reorder medications and supplies, check the ordered medication against the packing slip, accept payment for prescriptions and process claims, and much more. A prescription is an order for medication issued by a physician, dentist, or other properly licensed practitioner, such as a physician assistant or nurse practitioner. In some states, other practitioners have been licensed with a limited scope of practice. A prescription designates a specific medication and dosage to be administered to a particular patient at a specific time. Often the prescribed medication is referred to as a prescription. There are two broad legal classifications of medications: those that can be obtained only by a prescription or legend medications, and those that can be obtained without a prescription or over-the-counter medications. A prescription medication is also known as a legend medication because it bears the federal legend, which states a federal law prohibits dispensing without a prescription. OTC medications are deemed safe for an individual to take without being under a physician's supervision. As a result of the Combat Methamphetamine Epidemic Act of 2005, a subclassification of OTC medications has been established. These drugs are known as behind the counter medications. BTC medications and OTC medications that contain ephedrine, an ingredient used to make methamphetamine, which is a Schedule 1 controlled substance. Individuals who want to purchase products containing ephedrine must buy them at the pharmacy counter under the supervision of a pharmacist with proper identification. The purchaser must be at least 16 years old. The purchaser can purchase up to 3.6 grams of products containing ephedrine, which is pseudoephedrine, in one day, or no more than 9 grams within a 30-day period. Prescription written by a physician may be given to the patient to take to the patient's pharmacy or mailed to a mail order pharmacy. A physician may designate an employee of the practice to telephone a prescription into the pharmacy. In this case, the pharmacist must create a written form of the telephone order. A prescription also may be sent to the pharmacy electronically. This is known as e-prescribing. E-prescribing is the computer-to-computer transfer of a prescription data between pharmacies, prescribers, and payers. It is not the use of an email message or fax transaction. E-prescribing functions include messages about new prescriptions, prescription changes, refill requests, prescription fill status notifications, prescription cancellations, and medication history. E-prescribing involves a wide range of participants in the healthcare system, including practitioners, clinics, hospitals, provider associations, pharmacies, software vendors, trade and professional associations, laboratories, ancillary services, state and federal governments, and so on and so forth. We have many different advantages coming from e-prescribing, such as enabling prescribers to receive on-screen prompts for drug-specific dosing information, expediting refills, facilitating data exchange between the physician and the pharmacist, and ultimately the patients, linking information from a patient's medical file to a patient's prescription file, notifying the prescriber if a drug product is covered by the patient's insurance plan when the order is generated rather than when it is presented at the pharmacy, reducing or eliminating errors associated with bad handwriting. In most situations, it is the pharmacy technician who has initial contact with the patient when the prescription is dropped off. The first thing a pharmacy technician does when receiving a new prescription is to determine whether the patient has had prescriptions filled at the pharmacy previously. If the patient has filled prescriptions previously at the pharmacy technician verifies the accuracy of the information in the patient's profile. If the patient has never had a prescription filled at the pharmacy technician collects the necessary information, which includes the following: the patient's full name, patient's home address, telephone number, birth date, all allergies, patient's current physical condition, prescription drug card information, whether the patient wants to receive generic medications, a list of any OTC and BTC medications the patient takes, and a list of any herbal supplements the patient takes. This information is used to develop a patient profile for the individual. Originally, prescriptions were written using Latin abbreviations and measurements were expressed using the apothecary and Avo Dupias systems. Some Latin abbreviations are still used in the practice of pharmacy today. The metric system is the official system of measurements for weight and volume in the United States. However, some older physicians continue to use the apothecary and Avo Dupias systems in writing prescriptions. So here is a list of pharmacy abbreviations. And we have a more comprehensive list that is in Canvas. If you need help finding that, let me know, and I'll also make sure I post that in the study materials, where I won't go through these one by one. And then we also have table 8.2, which is metric household conversions. So we have the metric volume on this side, which is equivalent to this household equivalent here. We will be learning all of these throughout our math term that we will have. A valid prescription must contain specific information. Every prescription is required to have prescriber information, patient information, a superscription, an inscription, a subscription, and a signa. Prescriber's information includes the prescriber's name, office address, and telephone number. If the prescribed medication is a controlled substance, the Physician's Drug Enforcement Administration DEA number must be included. Some states may require the physician's MPI number and or medical license to be included on the prescription. And figure 8.2 is an example of a valid prescription. 8.3 is the example of a valid prescription label for that prescription. The patient's information includes his or her full name, home address, and birth date. The birth date is used as an identifier to ensure that the correct patient is receiving the correct medications. The date the prescription was written by the prescriber must appear on the prescription. If there has been a time lapse between the date the prescription was written and when it was received by the pharmacy, the pharmacist may question the intent of the physician and whether the patient's needs are being met. Some medications, such as controlled substances, must be filled or refilled within 6 months of the date the prescription was written. It is the responsibility of the pharmacy technician to be aware of any state regulations regarding the amount of time that may lapse from the date the prescription was written to the date it is presented for filling. The superscription, the RX symbol, is a contraction of the Latin verb recipe, meaning take this drug. It is used as the heading on a prescription and usually precedes the inscription. Presently, the RX symbol represents prescription and the pharmacy. The inscription contains the medication name, dosage form, strength, and quantity. Today, most medications are already prepared by the pharmaceutical manufacturers. However, the pharmacy may receive a prescription for a non-sterile or sterile compound for which the names and quantities of each ingredient are listed. The prescription subscription consists of directions to the pharmacist or technician on how to compound a prescription. Many of the medications dispensed today do not require compounding and therefore do not contain a subscription. The SIG is a Latin expression meaning to write on label. The signa is the instruction to the patient on how to take the prescribed medication. These directions are written using English or Latin abbreviations or a combination of the two. They are transcribed by either the pharmacist or technician when this information is entered into the pharmacy's computer system. This tells the patient how much, how long, and when to take the medications. We must remember that and assume that patient has no medical background. So we want everything to be clearly spelled out on the prescription label. A pharmacy may receive a new prescription by a variety of methods. Patient may bring the prescription to the pharmacy. A designated employee could call it in from the doctor's office. They could also fax the prescription, use e-scribing. Often the pharmacy technician is the first individual to come in contact with a new prescription brought in by the patient. The pharmacy technician should accept the prescription in a professional manner and review it to ensure that the patient's name, address, and any other required information are on the prescription. If the patient has never filled at the pharmacy before, we must get all of the information from the patient, including medications they're taking, conditions, allergies, insurance information, things of that nature. Computer systems are standard in pharmacies today because they can provide the following: improved efficiency, information to the pharmacist at a moment's notice, online prescription claim approval, reduction in prescription errors, speed in processing prescriptions. The pharmacy technician is responsible for inputting the patient's information into the pharmacy's computer system. So these are the items that we will need: full name, home address, telephone numbers, birth date, sex, allergies, generic preference, and request for non-child resistant containers. Today, many individuals receive prescription drug coverage through medical insurance. Many companies offer prescription drug coverage as an employee benefit. The prescription drug benefit defines the drug coverage that is provided to the member. An individual who is covered under a prescription drug benefit receives a prescription drug card. So here are the four things you need to process a prescription: the RX bin, the RX PCN, the group number, and the ID number. The NCPDP, the National Council for Prescription Drug Programs, provides a guide for the information found on a card. This card contains the necessary information for the pharmacist or technician to process the prescription. This is the information that will be needed. So basically everything I set up here, but just kind of written out. Um, we already know the PCN, the group number, the subscriber number, a person code, which identifies the specific individual covered. Some plans use O1 to identify the cardholder, O2 for the cardholder spouse, and O3 for the first child dependent. A help desk number should be on there. Also, in addition to all the things I said before, which is a 24-hour service that enables the pharmacy to obtain assistance in processing a prescription claim. The pharmacy technician must verify the prescriber's information is accurate in the computer system. This includes the name of the doctor, the office address, the telephone number, the DEA number, and depending on state regulations, the MPI number. The pharmacy technician must enter the name of the medication, its strength and quantity, the number of refills indicated on the prescription, and all quantities ordered are to be expressed in metric quantities. So if we got a bottle of ibuprofen for a patient and the doctor writes dispense 4 fluid ounces, we would enter that as 120 ml. After the quantity has been entered, the pharmacy technician must calculate the day supply of medication being dispensed to the patient. The day supply can be calculated using the following formula. So the total quantity dispensed divided by the total quantity taken per day. When calculating the day supply for either ophthalmic or otic drops, the technician should use the conversion of 20 drops per milliliter and calculate according to the following formula. For inhalation products, they're going to use this formula, which we will go over in depth when we do them. The directions for use by the patient must be entered in the pharmacy's computer system. Often the prescriber writes the directions using abbreviations, and the pharmacy technician must transcribe those directions. Each computer system has developed specific shortcuts that allow the user to use abbreviations that are translated into English when entering the prescription signa. Several hints for inputting the directions for use include the following. Begin with a verb, do not use abbreviations, identify the dosage form, indicate the route of administration, and use terminology in everyday language so that the patient understands it. If a prescriber writes as directed for the directions, the technician should promptly inform the pharmacist of this, and the pharmacist will call the prescriber for explicit directions. The pharmacy technician must enter the approved number of refills from the prescriber into the computer system. The prescriber must provide a specific number of refills for the prescription. Some prescribers may indicate PRN refills on the prescription. In this situation, the technician must be aware of the state's regulations regarding PRN refills. The pharmacy enters 0 refills if a prescriber does not enter any refills on the prescription. If a prescriber authorized a generic drug to be dispensed, the technician will dispense the generic version of the medication. Some states require the prescriber to write dispenses written or brand name medically necessary in their own handwriting on the prescription. Other states may allow the prescriber to check a box on the prescription. The pharmacy technician must be familiar with the state pharmacy's regulations regarding generic substitutions. Dispensa's written codes are a numeric set of codes created by the NCPDP that are used when entering prescriptions into the computer. If a pharmacist or technician fails to submit a prescription claim using the correct DAW code, pharmacy may not be reimbursed properly for the medication that was dispensed. In addition, a pharmacy may be audited by a third-party provider to verify that the DAW code used was. If a third-party audit reveals the pharmacy is improperly using DAW codes, the pharmacy may be held responsible for refunding claims that were submitted incorrectly. And this will happen quite a bit. So we want to make sure we're using them properly. Here is a little box with all of the dispenses written codes. So we have 0 as non-product selection indicated. That's what you're going to have for pretty much everything. One, substitution not allowed by prescriber. Two, substitution allowed, the patient requested the product dispensed. Three, substitution allowed, the pharmacist selected product dispense. And substitution allowed, generic drug not in stock. Substitution allowed, brand drug dispensed as generic. Six, override. Seven, substitution not allowed. The brand drug is mandated by law. Eight, substitution allowed, generic drug not available in marketplace. And nine, other. Prescription adjudication is the process by which a prescription is submitted electronically to a third-party payer so that the pharmacy can find out whether it will receive reimbursement for the medication. The pharmacy is notified of the status of the claim within a few seconds of submission. So pharmacy is kind of different than the doctor's office. If you go to your doctor's office and you give them the wrong insurance card, or for whatever reason your insurance has expired, they might not know that on the day that you're there because they don't do their billing instantly. They do it later. So when they do the billing, they find out, oh, this person didn't have insurance, so we're going to send them a bill. But for pharmacy, we find out right away if we're going to receive reimbursement. So we have an adjudication system that lets us know within seconds if the medication is approved, denied, too soon, or whatever the case may be. Table 8.3 lists some of the prescription claim rejection codes. So some of the common ones are missing or invalid pharmacy number, missing or invalid group number. So this stuff could be missing from the ID number from the card that you entered. So missing from what you've entered. Missing day supply, missing or invalid dispenses written product selection code. So when you're using these codes up here, if you're not using them correctly, it will usually reject. Prior authorization required, refill too soon. Those are some common ones you'll see, or drug not covered for the patient. The pharmacist is responsible for reducing medication errors and drug-related illnesses. As a result of OPRA 90, the pharmacist is responsible for obtaining information from Medicaid patients or their caregivers with the goal of identifying and resolving potential medication-related issues. Patient profiles are created and contain the following information, which the pharmacists use in reviewing patients' medication therapy. Adverse drug reactions, allergies, a comprehensive list of medications being taken, disease states, patient demographic information, pharmacist comments regarding a patient's drug therapy. A prospective drug use review is conducted during a drug utilization evaluation. It's a DUE, formerly known as a DUR, and that evaluates the following factors: clinical abuse or misuse, drug allergy problems, drug overutilization, drug underutilization, drug disease contraindications, drug-drug interactions, incorrect dosages, incorrect duration of drug treatment, and therapeutic duplication. So basically what that means is if you are running a prescription and it rejects, then you get these codes up here. Well, sometimes it's not going to reject, the insurance covers it, but it's going to come up for the pharmacist that they need to review it. Meaning that the medication can be closely related to a medication they're allergic to that's on file. So that is why it's important to have all this stuff on file. So it's pulling that from the patient's profile and saying, hey, you should take a look at it. One of the medications they're taking might interact with a new medication. One of their disease states could interact with a drug. If they're using the drug too much, so overutilization, underutilization, not using it enough. So well, either those two, you're getting prescriptions early or way late. And they're going through the insurance, but the insurance is wondering about the usage of their medication. And therapeutic duplication, if they think you're possibly doing clinical abuse or misuse, that might come up on the DUE as well. Most pharmacies scan the original prescription that they're given. Therefore, a digital copy of the prescription is available when a prescription is refilled. Also, if the original prescription is misfiled, the digital copy is available for the pharmacist to review. Scanning of prescriptions is a quality assurance tool that can help reduce medication errors. So, if anyone brings in a handwritten prescription or prescription on a piece of paper, you're going to scan it into your computer system. Every prescription filled should have a visually appealing and professional label. So, what that means is don't just slap on the label all uneven without any care. You want it to look nice. You want all of your information on the label to look nice and be easy to read and look nice and neat. It is extremely important that we do this. The professional appearance conveys to the patient that care was taken in filling their prescription. A legal prescription is required to have several pieces of information: the name, address, and telephone number of the dispensing pharmacy, a prescription number, prescriber's name, patient's name, date the prescription was dispensed, name, strength, and quantity of the medication dispensed, directions for use, federal legend. An auxiliary label provides the patient with additional information about taking the medication. Auxiliary labels may indicate when it is best to take a medication, like before a meal, or potential side effects, like may cause drowsiness or avoid sunlight. Or they may remind the patient to discard the medication after a given time, as with a reconstitutable antibiotic. Auxiliary labels should be affixed to the prescription container so that no important information, such as the National Drug Code, the NDC, lot number, or expiration date, is covered. Also, many places do not want you to cover the barcode of the drug if it's a unit dose bottle, like a reconstitutable antibiotic. So, your pharmacy could have one of these strips of all different stickers. However, most pharmacies now, it's just part of the printed prescription. I know at Walgreens, on the side, it prints the auxiliary label like right on the side of your prescription. You can see it there. And here's just some commonly used auxiliary labels for side effects. This is an important table to kind of study because for the PTCB, because these are kind of the questions that they might ask you about, you know, for taking this drug, what commonly used auxiliary label might we put on there? Things of that nature. So like contraceptives, we're going to put on there, take as directed. Non-steroidal anti-inflammatory drugs, we're going to put may cause dizziness or drowsiness and take with food, and so on and so forth. The federal government does require that the patient product information be provided to the patient when specific medications are dispensed. The purpose of this is to ensure that the patient is provided with information on the proper use of the medication. An example of this is some oral contraceptives, estrogens, and non-steroidal anti-inflammatory drugs, NSAIDs. So if you ever got a prescription for like ibuprofen, you might see a little white piece of paper, like regular computer paper, attached to the bag, and that's what this is. And it gives all this information. After reading and checking the prescription order, the pharmacy technician should decide on the exact procedure to be followed in dispensing or compounding the product. Many of the medications are already prepared for the pharmacy by the drug manufacturers. Pharmacy technicians should take the prescription label with them when they go to the shelf to gather the medication. They should compare the NDC number on the prescription label with the NDC number on the manufacturer's drug label on the bottle. The technician should pull the medication from the shelf and return it to the dispensing area of the pharmacy. The pharmacy technician must take great care in selecting the prescribed dosage form and strength and number of units dispensed, dosage units dispensed. The prescription label should be checked with the original prescription and the manufacturer's label. The prescription should be checked a second time with the prescription in the drug manufacturer's bottle. A final check should be performed right before the prescription is bagged for pickup. Any medication that appears to have deteriorated or has passed the manufacturer's date should never be dispensed. Many pharmacies use automated filling machines that include verification by laser technology. The pharmacist reviews a finished product by scanning the bottle and checking NDC barcode and drug chosen against the prescription. In some instances, the pharmacy may not have the medication on hand to fill the prescription. The pharmacy technician will promptly let the pharmacist know, and the patient should be informed of the situation, and the pharmacy should offer to order the medication for the patient or to locate it at another pharmacy. Most of the time, we can get Monday through Friday, we can get the medication in the next day. Many pharmacies use a tray with a spatula to count solid dosage forms, which you will use with your Science Interactive Lab kit. It is best to count the dosages in multiples of five. So, yes, you should always be counting your drugs in multiples of fives. It makes it a lot quicker. And if you're counting by just one at a time, I can tell you that in a high paced, fast environment like pharmacy, you're probably someone's going to say something to you really quick. So you won't be doing it for long. So yes, you want to make sure you're counting by fives. We should make sure that we are cleaning the counting tray after each use, just so that there's no contamination between the tablets and the capsules. One reason for this is a patient could be allergic to penicillin, which is sometimes a powdery type drug, meaning when you pour it from the bottle, like some excess powder comes out with it. Um, just from settling to the bottom. And if that powder just sits on the tray like for the next hour, then any prescription that was counted on that could have penicillin residue on it. And if somebody's allergic to that, that could cause them some issues. And this figure is a technician filling a tray with patient's medications and then also placing the tray in the machine once filled with the correct medications. Many pharmacies use equipment to scan the barcode on the drug manufacturer's bottle and compare it to the NDC number of the medication selected. If the scan barcode does not coincide with medication's NDC number, the pharmacist is notified. This is used as a quality assurance measure to help eliminate medication errors. When dispensing a prescription, the pharmacy technician may select a container according to size, color, and composition. The selection is based on the type and quantity of the medication being dispensed. So, at some more of the higher chain pharmacies like Walgreens, which you'll hear me talk about Walgreens a lot because that's where I started in my pharmacy career. They have actually where it tells you on the thing you're filling what to use and what size bottle to use. So you might dispense in an applicator bottle for topical medications, dropper bottles, ointment jars, collapsible tubes, prescription bottles, liquid prescription bottles, round vials, things of that nature. Most of them are amber in color and are made of either glass or plastic. The amber color protects the medication from breaking down because of exposure to sunlight. It is extremely important that the pharmacy technician package the medication in a container that ensures the drug's strength, quality, and purity. Poison Prevention Packaging Act requires a pharmacist to dispense a prescription in a container that has safety closures unless the prescribing physician or patient requests otherwise. The request for non-child resistant containers may be for a single prescription or for all of the patient's medications. It is the responsibility of the pharmacy staff to obtain a signed waiver from the patient making this request, and this information should be entered into the pharmacy's information system. So again, just like at Walgreens, we had a thing that told us um, whether or not to put it on there right when we were filling it. Some medications, however, do not need to be dispensed in child-resistant containers, and that is nitroglycerin because the patient must have immediate access to the medication in emergency. So that's the little tiny bottles of nitroglycerin. You'll see them when you're in the pharmacy. Oral contraceptives and various other nasal and oral inhalers also do not need to be in child-resistant containers. The prescription label should be affixed to the medication container and should convey a professional appearance. So one thing too that I just want to add that I think is kind of interesting over the last few years, I've noticed that a lot of eye drops now have a child protection type top. So that's just kind of interesting because obviously before they did not. All right. The pharmacist is responsible for checking the final prescription before it is dispensed to the patient to eliminate the possibility of a medication error. The prescription should be checked to verify the actual medication strength is being dispensed according to the prescriber's original prescription. The pharmacist should verify the patient's name, the prescription's directions for use, the prescription number, the date, and the prescriber's name. The pharmacy's information system maintains an electronic record of all filled and refilled prescriptions. However, the pharmacy is required by law to maintain the actual hard copy of the prescription, and the Controlled Substance Act provides the following two options for filing filled prescriptions. And this is not the filing of the medication bags, this is the filing of the actual hard copy piece of paper prescription. So you can have three separate files, one that has a file for Schedule 2, one that has a file for Schedules 3, 4, and 5, and then one for all the other drugs. And that is how every pharmacy that I've worked at has had the filing done. There's another option with two separate files, one where you put the Schedule 2 controlled substances that are dispensed, and the other one which has everything else. Again, over 90 requires that an offer to counsel the patient be made to every Medicaid patient who receives a new prescription. Since then, many states have adopted this to apply to all new prescriptions and refills. It's pretty much just a standard. The pharmacist is there to answer any questions that the patient may need. Often is the responsibility of the pharmacy technician to collect a patient's payment for the amount due for the prescription. The pharmacy determines the available payment methods. And the patient often has the option of paying with a cash, check, or a credit card. Instructions for refilling a prescription are provided by the prescriber on the original prescription or by verbal communication to the pharmacist. A patient may call the pharmacy or walk into the pharmacy to request a prescription refill. The pharmacy technician must obtain the following information from the patient: patient's name, contact number, prescription number, medication name and strength, physician's name, and whether the patient will wait or return for the prescription. Many pharmacies use refill trees, which allow the patient to call in 24 hours a day to refill prescriptions. Many states permit a pharmacy technician to contact the prescriber's office to obtain a refill authorization. Depending on the system used by the pharmacy, the technician may submit a refill request electronically, transmit a fax of the prescription to the doctor's office, or use the telephone to call the prescriber's office. It is important for the technician to be familiar with the schedule category of a medication before requesting a refill authorization. Pharmacies are not permitted to refill Schedule 2 prescriptions. These require a new handwritten prescription. In addition, a specific medication such as isotretinoin, clozapine, and thalidomide have special processes that must be followed for refills. Both federal and state laws govern the transfer of a prescription from one pharmacy to another. Pharmacy technician may pull the original prescription from its file or pull it up on the computer system. The pharmacist is responsible for ensuring that the information transferred is correct. Once the prescription has been transferred from one pharmacy to another pharmacy, the original prescription becomes void. The transferring pharmacist must record the following information from the receiving pharmacist: the date of the transfer, the name, address, and telephone of the receiving pharmacy, the name of the pharmacist at the receiving pharmacy, number of refills transferred, National Association of Boards of Pharmacy, the NABP number for the receiving pharmacy, and if it's a controlled substance, the DEA number of the receiving pharmacy. This information must appear on the back of the original prescription on the computer system. Date of the transfer, name, address, and telephone number where the prescription was originally filled, name of the pharmacist at the original pharmacy, number of refills transferred, Original date of the written prescription, NABP number for the originating pharmacy, and of course, if it's a controlled substance, the DEA number of the originating pharmacy. The State Board of Pharmacy regulates the practice of pharmacy for that state. Their regulations determine the physical standards for all pharmacies. The standards include the minimum amount of space for the prescription department of the pharmacy. The pharmacy must be well lit and ventilated, and the proper storage temperature must be maintained to meet the specifications of the U.S. Pharmacopoeia for drug storage. Prescription counters should be used only for compounding, dispensing of drugs, and necessary record keeping. The prescription department must have a sink with hot and cold running water, must have adequate refrigeration equipment with a monitoring thermometer for the storage of drugs requiring cold storage temperatures. The pharmacy department must be maintained in a clean, sanitary manner and in good condition. The pharmacy also must have adequate trash receptacles. The state board requires all pharmacies maintain a current dispensing information reference source that is consistent with the practice of the pharmacy. Regardless of the state, every pharmacy is required to have a current copy of the Controlled Substance Act, a current copy of the USPNF, and any other reference mandated by the state's BOP. A pharmacy is required to have a prescription balance that is sensitive to 15 milligrams and weights or an electronic scale if the pharmacy engages in activities that require weighting of ingredients. The pharmacy must maintain equipment and supplies that are consistent within the pharmacy's practice. A community pharmacy is required to have a security system that detects attempts to break into the pharmacy. The purpose of the security system is to protect the pharmacy department when it is closed. The security system must meet current alarm industry standards and may be a sound, microwave, photoelectric, electronic, sonic, or any other generally accepted device. The alarm system must have an auxiliary source of power and must be capable of sending an alarm signal to the monitoring company if the main line of communications is not working. The prescription intake window is where a patient drops off the prescription to be filled. It is the location that a pharmacy technician collects the necessary information that will be used in developing the patient profile. The pharmacy bench is the work area of the pharmacy. Numerous tasks are performed at the bench, including the following: entering patient and prescriber information and prescriptions into the pharmacy's computer system, adjudicating prescription claims, scanning prescriptions into the pharmacy's information system, pouring and counting medications, scanning the manufacturer's drug container for quality assurance purposes, packaging and labeling the prescription, and the pharmacist checking the final product against the original prescription order, bagging the patient's prescriptions. The state BOP may require the pharmacy bench to be a specific length. The pharmacy technician must maintain a clean and clutter-free work area to reduce the possibility of errors. A community pharmacy stocks many different dosage forms, and the medications are often arranged on the shelves alphabetically. Some may arrange on the shelf by brand name, where others may arrange alphabetically by their generic name. Many pharmacies have a designated area for oral dosage forms, tablets and capsules, oral liquids, reconstituted liquids, oral contraceptives, inhalation products, topical agents, ophthalmic and otic products, vaginal and rectal products, and refrigerated products. Some community pharmacies have an area designated for fast movers, which are the more commonly dispensed medications for that pharmacy. A retail pharmacy has a lock safe to ensure that Schedule II medications be secure at all times. The safe may have a combination lock or a key lock, and it may be opened through biometrics if approved by the state BOP. The non-sterile compounding area should be away from other workflow to minimize distractions to the compounder and contamination of the product. The area should be kept clean and free of clutter at all times. It should have a controlled temperature and proper ventilation. All equipment and supplies used in non-sterile compounding should be easily accessible to the compounder. All equipment should be examined for cleanliness before use and washed immediately after use to prevent any cross-contamination between ingredients and the final product. Isopropyl 70% alcohol is often used to clean the compounding area. It is recommended that a log be maintained to show when equipment was clean. A sink with hot and cold running water and proper drainage is required by all state BOPs. Cleaning products such as sponges and brushes of various sizes should be kept next to the sink. Disposable paper towels should be kept adjacent to the sink. Trash receptacles should be kept at a distance away from the compounding procedures. All trash should be disposed of safely and properly, including personal protective equipment and hazardous waste. And these are just some of the equipment that could be used in the non-sterile compounding area. So your balance beakers, brushes, funnels, metric weights, spatulas, spray bottles, things of that nature. Mhm. Sterile compounding area. Some retail pharmacies have a sterile compounding area if the pharmacy administers vaccines or provides intravenous medications to its patients. The area must comply with the United States Pharmacopoeia 797, which has established specific guidelines for maintaining sterility and compounding and for addressing medication errors. The ASHP and the National Coordinating Committee on Large Volume Parenterals also have released guidelines describing the conditions and practices needed to process compound sterile products so as to prevent harm and even death as a result of cross contamination. Many pharmacies have a designated area where warehouse and wholesaler deliveries are picked up and received by the pharmacy technician. The pharmacy technician checks the medication received against the accompanying packaging slip to ensure that everything ordered was received. The pharmacy technician places the medications in their proper places on the shelves or in the refrigerator. All community pharmacies have an area where medication is reconstituted. Reconstitution is the process in which a dehydrated product is returned to a liquid state. The most common type of medication that is reconstituted in a retail pharmacy is oral liquid antibiotics. Distilled water is used to reconstitute oral liquid antibiotics, and medications that require reconstitution are not reconstituted until the patient actually arrives to pick up the prescription. Um, for two reasons. They're only good for a predetermined amount of days after mixed, and also if they don't pick it up, um, if it's not mixed, we can return it to the shelf. If it's mixed, we have to discard it. Some community pharmacies may repackage medications if they provide pharmacy services to long-term care facilities. These pharmacies may have unit dose packaging equipment to prepare unit dose medications for the facilities. Here is table 8.5 showing repackaging log information. A beyond use date is assigned by the pharmacy to replace the drug manufacturer's expiration date. The USP has changed its beyond use date method for non-sterile solid and liquid dosage forms that are packaged in single unit and unit dose containers. The BUD is 1 year or less unless stability data or the manufacturer's labeling indicates otherwise. BUDs are nearer than expiration dates to account for the fact that the manufacturer's original container has been opened in the repackaging process, thereby exposing the pharmaceutical article to ambient atmospheric conditions. All community pharmacies must maintain the original prescription on file for the minimum time required by the state BOP, including the daily prescription record with the signatures of the filling pharmacist. The pharmacy must maintain all controlled substance invoices for a minimum of 2 years, according to federal regulations. These records include completed DEA Form 222s, 41s, 106, biennial inventories, and change of the pharmacist in charge. Once a prescription has received its final check from the pharmacist, it is placed in a bin awaiting pickup by the patient. These prescriptions may be placed in a secure area outside the prescription department, not accessible to the patient, where access to the prescriptions is restricted to individuals designated by the pharmacist. The patient bins are normally arranged in alphabetical order, and it is very important that a patient's prescription be placed in the appropriate bin. State pharmacy regulations determine whether a pharmacy technician may provide a patient with his or her medication when the pharmacist is not present. So just a little side note about the patient bin. So if you accidentally file it in the wrong bin, which you will, and you'll see what I mean. Then next thing you know, we're all looking for the prescription. Everyone's in every single bin. We're looking in every single place because we literally can't find the prescription. So it's really important to make sure you're paying attention when you're putting those away, especially when you're new. Some retail pharmacies may have a separate pickup window for prescriptions. Other pharmacies may have the patient pick up the prescription at the drop-off window. Regardless of the arrangement, there is at least one cash register at this point. Once the pharmacy technician rings up the patient's prescriptions and collects payments, patient acknowledges receipt of the prescription by signing an electronic device for insurance purposes. Then the pharmacy technician should ask the patient if they have any questions for the pharmacist. As a result of changes made through over 90, a pharmacy must have a designated area for patient consultation. Depending on the state BOP's regulation on counseling, the offer to counsel may be made in any manner the pharmacist thinks appropriate in his or her professional judgment and may include any one or a combination of the following. Face-to-face communication with the pharmacist, a sign posted so that it can be seen by patients, a notation affixed to or written on the bag in which the prescription is to be delivered, a notation on the prescription container by telephone. If the offer to counsel a patient is accepted by the patient, the pharmacist counsels the person presenting the prescription to the extent pharmacist feels appropriate in his or her professional judgment. Information provided during counseling may include the following: the name and description of the medication, the dosage form, dosage route of administration, and duration of drug therapy, special directions, precautions, and preparation, administration, and use by the patient, proper storage, techniques for self-monitoring drug therapy, actions to be taken in the event of a missed dose. Within the past 2 decades, many retail pharmacies have established a drive-through window where patients can drop off a new prescription, request a refill, or pick up a prescription without leaving their vehicle. The drive-through window is an added customer convenience that saves patients time because they do not have to park their vehicles and walk into the pharmacy. If the pharmacy has a drive-through window, the individual responsible for that area is responsible for collecting all the necessary patient information when a new prescription is presented and payment when it's purchased. Pharmacy technicians have a strong technical skills that are essential in the practice of retail pharmacy. These include a knowledge base of diseases and their treatment with medications or through behavior modification, solid use of math and performing the necessary pharmacy calculations for compounding, the ability to transcribe a prescriber's order for medication, sound computer skills, excellent techniques for both sterile and non-sterile compounding, and one other important thing is interpersonal communication skills. They're necessary in the process by which messages are generated and transmitted by one individual and subsequently received and translated by another individual. Communication consists of 5 important components: sender, message, receiver, feedback, and barriers. The sender transmits a message to another person. The message is the component that is transmitted from one person to the other person. A message may be a thought, an idea, an emotion, information, or other factors that can be transmitted either verbally or non-verbally. Nonverbal communication includes facial expressions and hand motions. The receiver receives the message from the sender. Feedback is the process by which the receiver communicates back to the sender his or her understanding of the message. Barriers affect the accuracy of the communication. Nonverbal communication consists of a complex mix of behaviors and psychological and environmental interactions through which a person consciously and unconsciously relates to another individual. There are numerous barriers in nonverbal communication, including the following: body position in relation to the patient, facial expressions, lack of eye contact, and tone of voice. Although these may be interpreted as barriers in our culture, they may not be a barrier in another culture. Therefore, an understanding of cultural behaviors can be helpful to pharmacy technicians if they have a diverse patient base. The pharmacist is responsible for communicating with the technician in a clear and concise manner. Using the proper terminology ensures that the pharmacist and pharmacy technician share common definitions associated within the circumstance. Individuals assign meanings to their words based on their background values and experiences. In this situation, the pharmacy technician is responsible for listening intently to the pharmacist. The pharmacist should check with the technician to make sure that he or she understood the communication, and it is the technician's responsibility to request any clarification of the message. We should never make assumptions because false assumptions may adversely affect the patient's outcome. Sometimes there's a disconnection between the pharmacist and the technician because although the words mean one thing, the nonverbal communication demonstrates something else. Feedback is essential in communications between the pharmacist and the technician. Conversely, when the pharmacy technician is initiating the communication, the pharmacist is responsible for listening and providing feedback to the technician. Pharmacists play an integral role in making certain their patients obtain the desired outcomes with their medication therapy. The role of the pharmacist has evolved from medication centered to patient centered care. To establish a patient centered care environment, it is essential that the pharmacist develop a trusting relationship with the patient. This allows the patient and the pharmacist to be actively involved in the treatment that leads to the desired outcome. The National Academy of Medicine, formerly known as the Institute of Medicine, defines patient care as providing care that is respectful and responsive to individual patient preferences, needs, and values, and ensuring the patient values guide all clinical decisions. To provide patient centered care, the pharmacist must be able to do the following: build a therapeutic alliance with patients to meet mutually understood goals of therapy, develop a self awareness of personal effects on patients, foster an unrestricted relationship with the patient, identify the patient's experience as unique, understand the patient's illness experience, and the efforts of the pharmacy technician aid pharmacists in performing their clinical pharmacy activities. Other pharmacy communication is delayed because of challenges from distinctive obstacles posed by particular groups of patients. Many communication barriers often exist within these groups of individuals. As a pharmacy technician, it is vital that you sense an individual has a specific problem. You check your perception of that individual. If you are dealing with elderly patients, what is your initial perception on them? Are they forgetful? Do you consider them to have visual or auditory issues? Based on your perceptions, you make assumptions about this group of patients. The elderly population is increasing and living longer as a result of advances in the treatment of diseases and disorders with medication and behavioral modification. The elderly experience more chronic conditions than do younger individuals and therefore take a greater number of medications. As individuals age, they may experience a loss in their communication skills. Also, as individuals age, they tend to process information at a slower rate than younger individuals. The rate of speech and the amount of information an elderly person receives at one time must meet the individual's ability to understand the information. Also, the elderly person's short-term memory, recall, and attention span may be reduced. An elderly patient may develop hearing impairments. Hearing impairments may occur when something blocks the conduction of sound into the ear's sensory nerve centers, when damage occurs in the sensory center of the inner ear, or when the nerve centers of the brain are affected. A loss of hearing may be due to birth defects, injuries, or chronic exposure to loud noises. The amount of hearing loss varies among individuals. Some individuals may actually hear words and sounds yet not be able to comprehend the meaning of the words. Some patients could have difficulties with speech reading. They watch a person's lip, facial expressions, and gestures to improve their communication skills. As a pharmacy technician, you should position yourself 3 to 6 feet from the hearing impaired individual. You should never speak directly into the patient's ear because the sound may become distorted. If the patient is experiencing difficulty understanding what you are telling him or her, you should not repeat the sentence, but rather rephrase it in a shorter and simpler sentence. Some patients with hearing difficulties depend on speech reading. They watch a person's lip, facial expressions, and gestures to improve their communication skills. As a pharmacy technician, you should position yourself 3 to 6 feet from the hearing impaired individual, and you should never speak directly into the patient's ear because the sound may become distorted. You may also encounter patients with impairment. Speech impairment may be caused by a variety of factors, including birth defects, injuries, or other illnesses. Dysarthria is a speech impairment involving interference with the normal control of the speech mechanism because of damage to specific facial muscles. It can be caused by Parkinson's disease, multiple sclerosis, strokes, and accidents. Often, patients with the speech impairment may communicate through the use of notes or sign language. A pharmacy technician should always have a pad of paper at the prescription intake or pickup station for patients who want to communicate by writing. Another speech issue that may occur after a patient has experienced a stroke or other adverse event is known as aphasia. Aphasia is a complex condition in which an individual has a reduced ability to understand what others are saying and express him or herself. Depending on the severity of the problem, an individual may have no speech or may have difficulty with names or words. Other individuals may experience difficulty putting words in the proper sequence in a sentence. These patients may encounter problems in understanding oral directions, reading, writing, and the use of numbers. Patients with aphasia may have normal hearing, therefore, speaking loudly to them will not improve the situation. When dealing with a patient who has aphasia, it is best to speak with the patient's caregiver. Patients with mental health problems are also patients that we may experience difficulty communicating with because we do not know what to say to them. There are many stereotypes about patients with mental health problems that some of the members of the pharmacy team may believe. Some patients with a mental health disorder may be hesitant to speak with pharmacy members for a variety of reasons. These reasons can include poor self image and hesitancy to interact with other people. Many individuals find it difficult to interact with terminally ill patients. They may feel uncomfortable discussing the topic of death and experience difficulty finding the correct words to use. Most terminally ill patients need a supportive relationship with family, friends, and healthcare providers, including both pharmacists and technicians. Often, the pharmacy team may be the only healthcare provider in the community that a patient may encounter frequently. And the 5 stages of grief: denial, anger, bargaining, depression, and acceptance. Communicating with terminally ill patients and their families is extremely important. You should never avoid talking to them unless you sense they do not want to discuss the illness. Furthermore, not talking to them isolates the individual and may endorse the idea that talking about death is uncomfortable. According to the American Medical Association, health literacy is defined as the ability to read, understand, and act on health care information. According to the Center for Healthcare Strategies, a disappropriate number of minorities and immigrants are estimated to have literacy problems. And then you can read here about literacy problems. It's not just people that are immigrants or minorities, though. I know from working in pharmacy that people you would not expect can literally not read prescription labels, and not because they can't see or whatever, they are illiterate. So you can experience this in many different socioeconomic cases. Communication issues develop when information is provided to the caregivers of patients with chronic conditions, parents who take care of children with acute illnesses, family members, or friends. Caregiver must understand a patient's condition and treatment and how to effectively communicate the special instructions to the patient. It is extremely important for the caregiver to understand the importance of refilling the patient's medication. Often it is best the caregiver have written information so that it can be given to the patient at home. Customer service is defined as the provision of service to customers before, during, and after a purchase. Customer service in healthcare is different from that in other industries because the customers are recipients of medical services that are critical to their health. In the pharmacy, we provide OTC, BTC, and prescription medications to the customers and patients. In addition, the pharmacist provides information to patients to maximize therapeutic effects of the medications they are prescribed. The five rights of medication administration used by nurses also apply to pharmacy practice. So the right patient, the right medication, the right time, the right dose, and the right amount of administration. Box 8.2 has some common pharmacy customer service complaints. Box 8.3 gives some customer service statistics. Many community pharmacies provide immunizations to their patients. These include immunizations for influenza, pneumococcal infections, hepatitis A and B, herpes zoster, and varicella. Pharmacists can administer vaccines in most states, but with the release of the COVID-19 vaccines, many state boards are changing this rapidly to allow trained technicians to immunize. Another requirement of the ACA is medication therapy management. This is medical care provided by pharmacists whose aim is to optimize drug therapy and improve therapeutic outcomes for patients. MTM covers a broad range of professional activities, including but not limited to performing a patient assessment and or a comprehensive medication review, formulating a medication treatment plan, monitoring the efficiency and safety of medication therapy, enhancing medication adherence through patient empowerment and education, and documenting and communicating MTM services to prescribers to maintain comprehensive patient care. Overall wellness and disease prevention is now an integral part of the pharmacist's role, and the technician role often includes gathering information from the patient to complete a medication and disease history that provides counseling documentation. As the pharmacy profession embraces extensive patient counseling in the form of MTM, many aspects of the pharmacy practice must evolve to ensure the success of the program. Time constraints limit the ability of pharmacists to handle administrative tasks and represent a major barrier to the implementation of the MTM programs. Technicians can do some of the work to reduce this barrier. With proper training, technicians can assist pharmacists in the tasks that do not require the professional judgment of a pharmacist, freeing pharmacists to focus on clinical activities and making an MTM program more sustainable. So actually, just recently was working on the side doing some MTM work for a company, and it was a pretty interesting job as pharmacy technician. I've done medication reconciliation before, so it was somewhat similar, but it was way different interacting with people on the phone and virtually versus face to face in an emergency room like I had previously done. Got to know a lot about patients and their personal lives as well. Um, but also reviewed medications with patients very extensively, and um, it was a really good learning environment, and it was a place where you felt like you made a difference. So we can help with that by scheduling patient reminders, phone calls, doing the medication histories and health histories, filing and documentation of release forms and other things. Patient adherence programs such as packaging medication for times of administration is very common today. Even companies such as Amazon offer pill pack. Monthly delivery of medications that are pre-sorted and ready at the time of each required dose. This allows the patient to adhere to a specific dosing without the removal of bulk medications from prescription bottles. Often patients will need to purchase equipment or supplies to use at home. They may have been hospitalized and now need further care that can be done at home or with or without additional caregivers. Some community pharmacies have a part of their business that supplies these products known as durable and non-durable equipment and supplies. So usually this is going to be not like your chains like Walgreens or CVS, but usually more of the more local community pharmacies will have a side for medical equipment, and then I'll have a side for the pharmacy. An example of durable medical equipment would be a hospital bed or wheelchair. A non-durable product may be stockings or diabetic or ostomy supplies. Today's community pharmacy provides even more of these products or services for their patients for a variety of reasons. The number of elderly patients has increased. Patients prefer to be treated and to convalesce in their own homes. Services at home are less expensive than staying in a hospital or assisted living facility. The patient is able to maintain his or her independence. Technology has evolved such that traditional treatments now can be performed in the patient's home, and managed care supports the discharge of patients from a hospital to the home. Many community pharmacies have provided crutches, canes, and walkers for their patients within the past several decades. Some pharmacies have expanded their inventory of home healthcare products, and these are some of the products that they have expanded to. Some community pharmacies have contracts with long-term care facilities to provide medications for their residents. Long-term care facilities include subacute care facilities, correctional facilities, assisted living facilities, and broad and care homes. As in a traditional community pharmacy, technicians assist the pharmacist in providing long-term care services. Packaging for long-term care services is different from the traditional bottles of 30-day supplies of medication. The packaging is in blister cards or strip packaging to make it easier for dispensing and changing orders. Long-term care facilities use 30-day cards with individual pockets for medication so that each dose is separated and given individually. The unopened blisters or pockets remain untouched and therefore can be returned for order changes if necessary. Pharmacy technicians may perform dispensing tasks associated with the packaging for long-term care medications, and some of the other responsibilities are billing the prescription, entering the computer data on prescription drug and non-drug orders, maintaining a drug library, maintaining repackaging equipment, and transporting medications to the facility, and many other things. Many of today's community pharmacy settings have incorporated wellness and disease prevention roles for technicians. The pharmacist is now an integral part of the patient's overall well-being and disease management for diseases such as diabetes or heart conditions, and these are included in the prescription dispensing process. Point of care testing, medication synchronization medications, and current patient medication histories allow the pharmacy team to have accurate electronic records. Information such as disease states, immunizations, current conditions, providers, and medications are recorded and maintained often by a technician. For example, a patient is a smoker and has been instructed by the physician to stop. The patient may have questions about patches or other forms that best suit them. A diabetic patient may need to purchase a meter and has no idea about which one or how to test. The technician could help choose a meter and align the strips and lancets that go with the product chosen. Other OTC medication options is another area that patients may need assistance with in the community setting. Technicians must understand that OTC medications and even herbals or vitamins can have interactions with other medications that are being prescribed, and helping to maintain an electronic record of these is essential to a complete medication profile. And do you remember these key points? There's quite a bit of them for community pharmacy.